Tom is 68 years old. He's married and has been diagnosed with terminal lung cancer. He was transferred from a hospital to a skilled nursing facility where he refused hospice and said he just wanted to die. Early in his stay, Tom was found with his oxygen line wrapped tightly around his neck. After removing the oxygen, staff found him trying to hang himself with the cord from his pants. Tom received a psychiatric evaluation in an emergency department and was admitted to the hospital's inpatient psychiatric unit.
That scenario makes me feel of compounding issues. You know, you have someone who's aging and all of the challenges that come along with aging, and then you get a diagnosis that's terminal, like lung cancer. You feel hopeless. You feel like there's no purpose in continuing to live, that you're just a waste of time and a waste of space, someone that's on their way out sooner than expected, and you feel a lack of control.
We can guess that Tom feels like a burden, that Tom's primary thought is, well, fear. Any one of us would be afraid. If we're diagnosed with terminal lung cancer, that sounds painful. That sounds like a lot of doctors. That sounds like a lot of decisions being taken away from me. It sounds like a lot to put my family through. And that sense of burdensomeness is also a risk factor in any suicide, but in older adult suicide, specifically in this case, I think we can guess that the idea that someone would have to care for me. Maybe I was the breadwinner, maybe I was the caretaker, maybe the family relied on me and now they can't. That thought may be too painful to bear. There are two things Americans are afraid of. It's being old and death. Those are two things that we don't talk about in any context. I mean, you put them both in one conversation, and that is a conversation we are not gonna have. People are not necessarily afraid of dying as such. They're afraid of the medical events around that death. They're afraid of being in an institution where all of their decisions are taken away from them. They're afraid of all the machines that go bing. They're afraid of our medical system that doesn't feel very welcoming sometimes. They're afraid of a doctor saying X is wrong with you, so Y is going to happen, and having absolutely no autonomy in that decision. And there's an assumption that if you tell a doctor, I'm struggling with X, that the rest is just going to happen, that it's a natural chain of events. Folks don't realize that they have patient rights. They don't realize that they can refuse treatments.
I think there has to be much more suicide risk awareness in every setting where older people reside. Nursing homes are not themselves mental health facilities, and I think basically more attention has to be paid to possible hazards or have access to means that can be used to harm themselves that they may have already access to. This includes, for instance, stockpiling pills by mouthing pills and hiding them, or getting access to plastic bags in trash containers, things like that.
One of the problems with talking about suicide is that everybody thinks it's somebody else's problem. The doctors think it belongs to psychiatry. Psychiatry thinks maybe the therapist will deal with it. The therapist thinks maybe if it gets too bad, I'll send you to a hospital. And that makes it hard for folks who are thinking of suicide to know who to talk to without feeling disregarded, without feeling like they're just being pushed along some chain of events until ultimately they're hospitalized against their will, and maybe it starts all over again.
There's been a lot of talk about baby boomers, the silver tsunami, the aging of America. Well, it's not only the numbers of older people, which are a fast-growing population. Baby boomers are going to be aging out. The oldest baby boomers are in their mid to late 70s already. That population has been at high risk of suicide at every age group, even from their teen years on, for reasons that aren't quite clear. But they've always accounted for a lot of suicides in the United States. And it's only going to increase as they move into their so-called golden years.
If more and more people are hearing this from our political leaders, then that is going to raise awareness, and that's going to hopefully motivate people to make changes, to add dollars where they're needed to go, to make sure that leaders of state departments are talking to each other. In Pennsylvania, there's a Department of Aging, and there's a Department of Health and Human Services, there's a Department of Health, and all of these departments focus on older adults, but in very specific, isolated, unique ways. And we need to be working more together, combining our resources. We're serving the same folks in a lot of scenarios, and we need to understand holistically that a person needs physical supports as they age and mental health supports as they age.